My name is Oliver Brown, an orthopaedic registrar at Croydon Hospital. Welcome to this video on wrist fractures. Wrist fractures are one of the most common injuries, and especially as we get older. In young people, wrist fractures are often high-energy injuries, such as in road traffic collisions. These can often be complicated by other injuries. In older people, these can represent a fragility fracture, which means your bones aren't as strong as they once were. In this situation, it's important to have a bone health review, including checking your vitamin D and calcium levels. You may benefit from medication to improve bone strength to prevent further fractures, which can be discussed with your GP. These injuries can be treated without an operation, and a well-moulded plaster cast is often all that's needed. After being seen in the emergency department, you'll be given some pain relief and your wrist may be pulled into a more acceptable position. You'll be sent home and the orthopaedics team will review your x-rays in the trauma meeting the next morning. They'll then contact you to let you know whether you require an operation or not. Many of these injuries don't need an operation, and if the bones are in a good position and represent a stable fracture pattern, you may be seen in a week in fracture clinic for a check x-ray. If your x-ray is fine, you'll be put into a fiberglass cast and seen in another 3 to 4 weeks to have the cast removed. When the cast is removed, you'll be given a wrist splint to wear for 2 weeks. At this point, you should not take part in contact sports or heavy lifting for another 2 months. If you're having surgery, this will either be with wires, which are then removed subsequently, or with a plate and screws. Wires will be removed after 4 to 6 weeks and are removed in fracture clinic without pain, while the plate and screws don't need to be removed and stay for life. After surgery, you'll be put into a plaster cast or wrist splint. Your surgeon will inform you of their plan to follow you up and removal of the cast. To get the best out of your recovery, you should aim to elevate your hand in the first few days after the injury. If your hand is higher than your heart, the swelling will reduce and the pain will be better. After the first few days, you should try to keep your fingers moving. If you don't move them, they'll become stiff very quickly and can take some time to come back to normal. You shouldn't lift anything with the affected hand though until your surgeon says it's safe to do so. If you're not having surgery, this may be around 8 weeks after the injury. Although wrist fractures can be complicated injuries, many patients do well without surgery. I hope you found this video useful and that it's answered any questions that you may have.